How you can practice on Sehgal method? Number 1 point, you must know all the rubrics from the books. Rubrics, number 1, because we only deal with rubrics. Okay. Which book you must start? You must start with Kent repertory only. Nothing else. No software. Only by Kent repertory. In the Kent repertory, only read mind rubrics. Nothing else. Do nothing. Open the repertory every day. Read few rubrics. Just keep in mind that there are rubrics in the repertory. Okay. When you finish with this repertory, when you finish only reading, only go through only one time, go through all the rubrics. Finish. Then again open. Again read all the rubrics. Second time, all the rubrics. Like this. Now look for the rubrics which only have one medicine. Okay, like I show you. Okay. Like this rubric, fear of extravagance. We only have opium, only one drug. Okay. So first go into the Kent repertory. Look only for those rubrics which only have one medicine. After you collect all this, okay, there are few rubrics, 50 rubrics. This rubric only have one medicine. So first you have to learn those rubrics, because then it is easy, because then you don't have to differentiate between the medicines. Because the hard part is to differentiate between the medicine. Then you go to the another part of the rubrics after 10 days or 15 days, having two rubrics, two medicines. And slowly you go to different rubrics. That is the first part. Now, after you know the repertory very well, okay, this is rubric, and then choose those rubrics which are very interesting for you. Very interesting. Okay. Now you can say, okay, fear of extravagance. Oh, what is this rubric? Yogesh has told us about this rubric. Now, what is extravagance? How can I apply it? How can I use it? Then you can go to our books and find that the book number 4. We have a book number 4. That is you can start study from there. Book number 4 of our book. Just excuse me. Book number 4. And here we have rubrics, all the rubrics, only rubrics. How to use the repertory. Now, number 2 point now. After you go through all the rubrics, then the next task is to understand the meaning of each word. Now that is the second part. How to understand the meaning of every word. So, how we select the medicine? Medicine is selected on the basis of the thoughts prevailing in the mind of the patient at the time of their sickness. Number 1. Number 2, after the medicine, the exaggeration or the excess of these thoughts gets balanced, and in return, a chain reaction happens, that is of elimination from the body in the form of excreta with corresponding relief in the particular disease. Now, for example, a patient visit for an eye problem. He say, in case his eye won't get better, it may hamper his future prospectus. This is in the shape of fear, and we interpret the thought to be fear of being betrayed. This is the rubric, fear of being betrayed, on how I'm going to survive in future. Now he has a fear that his problem will deceive him. You know, this patient is hyoscyamus. Now we will give medicine to balance this thought of fear, and as a result expect some discharge. Say it may be from nose, eye, and a corresponding relief in the disease relating. Patient has come to us with eye problem, and I am using his thought, and then this thought is interpreted into the rubric fear of being betrayed. Okay, now what will happen? So we will give medicine to balance this thought of fear, to balance the fear first, not the eye. And as a result, something can happen from eye, some discharge, some agglutination, some white discharge, some watery discharge can happen from the eye, or maybe somewhere else. We don't know where lies the excreta, where is the elimination can start. Say it may be from nose, it can happen from nose also, not only from eye. We don't expect things to come from eye. We can expect that thing could come from nose also. And then what happens? The disease will get better. So that is the process of cure. So, and so this is, you have to keep in mind while learning that all the symptoms of a patient may not be found in one remedy. So for example, I gave you 50 rubrics of a remedy. I teach you 50 rubrics. Now don't expect that all these 50 rubrics you have to see in one patient. It's not possible. There could be possible that at the given time when the patient is visiting you, few rubrics are predominating, but others are not. Even if I tell you this rubric is very good for gelsemium, this is a very good rubric of opium, but it's not necessary that that rubric will come first in the patient. It depends upon the severity of the problem, about anticipation and fear. Now, again, I want to tell you what is anticipation. Trying to foresee or realize beforehand. A patient anticipate about something which he already suffered in the past and how torturous it was and how many days it took to get recovered. Now, what is patient anticipating? Patient is not anticipating the problem will come. The patient is anticipating the torture he has suffered because of the problem. That is his worry. So, for example, what happened? 3 times in the past, patient noticed a pattern. A pattern means first, for example, he feel vertigo, little vertigo. Second day, headache start. Third day, sneezing start. Fourth day, fever comes. Then collectively, there are 4 symptoms. And then he is completely weak or has to lie in the bed. He can't move. Now, this pattern patient knows first time. Okay, he got better by anything. Second time, after 3 months, same pattern, same thing occurred. In the same pattern, no change. Now he noticed the pattern. So this is the pattern. And third time, what happens? As he knows the pattern, when the vertigo starts, he knows now the headache will come. And then sneezing will start, and then the fever will come. And then I have to be in the bed. Now he's already anticipating from the past 2 experiences the pattern of the problem. But if there is change in the pattern of the problem, then he gets surprised. But when when a patient comes to me in the beginning of the pattern, for example, he tells me, doctor, I have vertigo now. And I know after a few hours, headache will come. And then after a few hours, sneezing will start. And then the fever will come, and then there is no turn. Then I have to take allopathic medicine, or I have to go to hospital, or otherwise I will be in the bed. So what is the last point? The last point is then he had to suffer. Now, this is called anticipation. Maybe it's clear now. It's clear, everybody? You can raise hand, yes or no. Yes, Bahare? Okay. Now, what is fear? Now, fear is a sort of discomfort aroused by impending pain, danger, or evil, which is specific in nature. A person can identify the subject of his fear. Number one, a patient fear about something about which he previous knowledge from seeing others suffering, not his suffering. Somebody else suffered in my family. I fear I may also suffer. Are you getting my point, Bahare? Okay. But has not suffered on his own. He thinks that if such and such situation will come, then how will he manage? For example, doctor, I come to you because now I'm 50-year-old. As such, I have no problem. But I saw my father when he was 40, he suffered from very bad ailment. Now, as I'm 50-year-old, I'm okay now. I have no problem. I fear now that maybe my situation is like my father. So this is not anticipation because he has nothing. Is it clear now, everybody? Show me your hands that yes, is clear. Who is not clear yet? He has to come to India then. That's the only possibility. Well, good. So now you are clear. Now, another part is, the question is, he asked me fear of ordeals. Now, what is ordeal? A very unpleasant or difficult, painful experience. Fear of extensive medication, investigation, long procedure, serious or long-lasting illness. Now, what happens, like Jersimum is here, and Jersimum is here also in anticipation. Okay. The first part is anticipation, like a pattern. When a Jersimum patient realizes the pattern, first symptom, second symptom is same like last 3 times, he gets worried. He gets anticipated. Oh, now the third point will come, the fourth point will come, then I will be in the bed or I have to go to hospital. Now, that is anticipation. Now, what is ordeal? Ordeal is that he, in the mind, there is also another information that if this attack, this time, if this attack will not come under control, or he will not control it by any medicine, he has to take medicine, else he will end up with a great suffering. That is ordeal, which he doesn't want to go through. He said, the patient say, I don't want to take antibiotic now. I don't want to go to allopathy now. That is why, doctor, I have come to you. I come to you at the second point. I don't want my situation will go to such an extent where I have to take extensive treatment, extensive medicine, investigations. This I don't want to go. That is called ordeal. We have to understand this rubric with fear of extravagance. Okay. Now, what is fear of extravagance? In fear of extravagance, the fear is there. See, first, you have to understand when you are making a DD, like anticipation, but anticipation has no prefix fear. But when you are talking about fear of extravagance, the rubric is completely different context. It has fear. It means that presently, there is nothing. Fear of extravagance, only for the future. What is extravagance? Okay, now, for example, a patient comes to you. Patient says, doctor, it is already a long time now. Therefore, I shall not be interested in the treatment which cannot give me immediate relief. It is already long time and I cannot wait. The minimum that I expect is that the intensity of the disease should be reduced to the extent which should remain within my tolerance. Because I know I do not care for the minor trouble. Many times I don't bother for the most of the minor troubles unless they prolong. So, for example, a patient comes to you and he tells you, for minor problem, doctor, I never go to a doctor. If there is a 10% problem, 20% problem, I can manage. I can handle it. I don't go to the doctor. So why you come to me today? What happened? But today, doctor, what happened? Yesterday or 2 days ago, I started to feel, okay, what is fear? A feeling that the problem is growing. And yesterday, it was so much, I could not tolerate the pain. I could not. It was so much. And then I decided I have to take the medicine at least to bring the problem or bring the pain under the tolerance level. So I come to you to firstly, I want you to give medicine to bring this problem to a tolerance level. That is my fear. Because I have fear if I don't take medicine today, the problem will go beyond my tolerance power, and that I worry. So this is called extravagance. Extravagance of what? Tolerance power, beyond tolerance power. So you have to listen the words very carefully. In Sehgal method, Bahare, Parisa, you have to hear the language very carefully. Even if you miss, you can ask your patient to repeat the same language without changing it. You can ask the patient, can you tell me the same way, exactly the way you told me? Exactly, not to miss it, any single word. Or you can repeat. So you have a fear that if the problem will increase, then you won't be able to tolerate. That is the worry. Yes, doctor. That is my worry. I don't want this problem to grow further. Then it will go beyond my tolerance level. And that I fear. So opium is clear. Very clear. So what is the problem of opium? Tolerance level. That's all. You can give opium blindly. So only this word, the patient, you only have to hear. Word tolerance level, yes. Or a patient says, I only go to a doctor when I feel my problem is going beyond my tolerance. Till I tolerate, I will not go to the doctor. This is opium. Till I can tolerate, I don't go to the doctor is also opium. So opium will not come to you till he can tolerate it. So the word tolerate is equal to opium. Very clear, as in the shortest way of doing homeopathy. So you have to make yourself trained to listen this word. I don't know how in Iran the people they can use the word tolerance. And it could be for it could be for anything. It is not about physical problem. For example, a patient tells you, doctor, one time, if somebody tells me something, I can tolerate. And listen the word tolerate again. One time, if somebody says me something, I tolerate. Second time, if the same person says something wrong, I tolerate. But third time, I can't tolerate. Then I get irritated. This is also opium. So when anything emotionally or physically, anything goes beyond the tolerance level, this is opium. Then he reacts. Okay. And then the patient says, actually, it is not the difficult breathing that I am bothered. I have a difficult breathing. Okay, that I can tolerate. But the problem is pain. The pain is too much, doctor, too much. I can't tolerate. It's too much. Or number two, doctor, breathing It's okay. I have difficult breathing. But the problem is my work is suffering. Now, today is the fourth day. I did not go to my clinic. I did not go to my shop. I did not go to my office. Today is the fourth day. Now, if I don't go tomorrow to my office, then what will happen? It will be too much. Tomorrow I have to go my office. And what is this rubric? Now, business talks off. So you see the patient maybe start like, doctor, you know that today is the fourth day. And now this is the first opening of the case. Why he come to you to take the medicine on the fourth day? So the patient will not say any extravagance. He said, doctor, today is the fourth day. I did not go to my shop. 4th day, my shop was closed. But tomorrow I have to go to my shop. I must. Otherwise, it will be too much loss. So this is about business talks of. This is also opium, but in a different way. He's not talking. Now here the extravagance is in the terms of business. So when a patient says, 3 days I suffered, yesterday was the 4th day, I'm worried about the 5th day, 6th day, 7th day, it will grow. So that is, you consider the rubrics like fear, extravagance, and irritability, pain during, and business talks off. So you can understand by these examples that, okay. Now, next, for example, a patient comes and say, it is not within my capacity now to bear anything, this sort of torture. Okay. So what we understand, we try to understand the attitude of the patient. Okay, for example, a patient comes to you, okay, like a child, not a child, an adult patient, but he speaks like a child. Have you ever heard, Katie, where is Katie? Have you ever heard that somebody tells you, not as a patient, maybe you have heard from your friend that if their father, mother, husband, wife, they get sick, they start to behave like a child. Yes? Okay, good. Now, this is also happening with our patient. Some patient, when they come to us, even they are adult, they talk like a child. They are not child, but they talk like a child. Like what? Doctor, see, what is my condition? Please tell me how it will be cured. Can you tell me how long will it take? Please, doctor, tell me, please. Like a child, insist. What is it? You don't tell me. See, whenever I come, doctor, I always ask you, what is my problem? You never tell me. You only say, oh, it will be okay. But this time you have to tell me, oh, what is my problem? I want to know. Why you want to know? Oh, I want to know. Because it's my problem. And also, now, see, I have been coming to you. This is the 6th time, doctor, I'm coming to you. You always make promise. Next time you will get better. No, this time you have to tell when I will get better. You have to give me medicine. I will not come next time. I bring so many patients to you, and every patient get better, but you never care about me. You always say, oh, you will get better, but you never, I think you don't give me good medicine. I want that today you will give me good medicine. Or I will not come. Today I thought that I will go to you and I fight with you. Now, what is this, doctor? I sent you 5 patients. Everyone got better. But in my case, no relief. Now I want that you should give me medicine. Tomorrow I have to be better. Now, this is the tone of the patient. Like patient is fighting with you or asking you that what is this nonsense? You are not giving me, doctor, I think you are not giving me attention. Whenever I come, you only give me 2 minutes. I think you don't listen me properly. Now today I want that you should listen me properly and give me good medicine. Otherwise I will not come. Now who is this patient? Anybody?
Belladonna.
Very good. Why belladonna?
Frivolous was the rubric.
Okay, there is a rubric called quarrelsome, anger without. I show you. Auntie से बात करें. See, there is a rubric. We have quarrelsome, anger without. It has belladonna. This is the very good rubric of belladonna. Sometimes the belladonna patient, when they are not getting better, they come to your clinic after 5 times, 6 times, and they say, doctor, now this time I have to ask you one question. Now you have to tell me, are you going to treat me? Are you going to give me the medicine to get better? Or you ask me again and again, only promise. So this is a quarrel. He's quarreling with you. Now what is quarreling? Arguing. Okay. So he likes to argue, but he doesn't want to fight with you. So like a child, like what is belladonna child? A belladonna child, for example, a teenager or a child is sick. He's lying in the bed, and mother sometime and sometime the mother is busy. She can't give the time. Okay. Now mother say, okay, you lie down, I will come. But mother is busy. She forget the child. And now what the child says, oh, you are not good mother. You only say I will come, but you don't come. I don't like you. The mother say, okay, I sit with you. Okay. And the mother say, when I sit with the child for 5 minutes, 10 minutes, then he's okay. And then I can say, okay, I can go. Well, I will come after half an hour. Okay, come, but come after half an hour. Okay, don't get delayed. And after half an hour, if I don't come, then again the child quarrels with the mother. Quarrels, not angry. Oh, mommy, what is this? You always say you will bring me this, but you never bring. Last time you promised you will bring me ice cream, but you never bring ice cream. Oh, what is this, mommy? So this is a kind of belladonna. I told you also about the rubric light desire for. Maybe you have all understood it or not, I'm not sure. Now, light is something that makes things visible, or light can also be like a ray of hope. We can use this rubric for those patients who wants to be assured again and again. from the beginning till the end of the case, repeatedly they may ask from the doctor, are you sure that I shall be cured or I shall be well? Now, who is this patient? Who will ask the doctor? Anybody who can tell me who is this patient in light desire 4 who is asking the doctor, doctor, are you sure?
Gelsemium?
Gelsemium. Very good. Very good. Nice. Gelsemium. Now, you understood that the light desire of the gelsemium is positive response. He doesn't want to hear negative response from the patient, doctor. And the word he uses, see, I'm giving you the words. I'm not giving you very hard things to understand. Only few points. Doctor, are you sure I will get better? That's all. Finish. You know, whenever I go to the doctor, I only want to know if I get better or not. You know, last time I went to a doctor, I asked him the same question. He said, maybe I left the treatment. Because that was, he did not tell me whether yes or no. So I'm asking you, do you think I will get better? Now, if you know that he's gelsemium, so certainty is there. At least you are certain he's gelsemium. You know, what we want to give now to you, what I want to give you. I want to give you so that you can be certain about your prescription. Number one, at least you know that this patient is gelsemium. You are certain it will work. That is the first point of your own confidence. Because you need confidence. You are giving the right medicine or wrong medicine. So when I hear such a statement from a patient that he has already been to the last few doctors, but he did not stay with them because they never told him convincingly that he will get better, and he left them. And today he's trying me because with the hope that I will tell him that yes, his case is curable. Now, this is certainty. He is gelsemium. Number one. Okay. So certainty has to be there. Otherwise, you are doubting yourself. Next point of light desire. This I told you about gelsemium. And now next what? We can use this rubric for okay. Rather, he will request you to tell him that he will be cured because he doesn't want to listen the word no. Some patients would only like those physicians who give them hope of recovery or interesting in leasing the, this is all gelsemium. No, okay, this is also very good rubrics to understand what is the word avarice and what is the difference between greed. Okay, anyone who can tell me anyway, Persia, if you can tell me the difference between greed and avarice and how we see in the patient. See, first thing, a patient will never say directly, oh, I'm avarice or I'm greedy. Maybe greedy, yes, but not avarice. But why a patient has to be avarice and why a patient has to be greedy? About what?
Sir, average patient don't want to spend. Greed wants
Okay.
to have more.
Okay. And greed?
Wants to have more.
I make you very easy. You know, if you learn from me, the first point is to make the life easy for you. Now, avarice is whatever is mine, it should not go out. For example, whatever is in my pocket is mine. I will not share with other. Number one, this is called avarice. Okay. And what is greed? What is mine. What other have should also come in my pocket. That is greed. Greed is also to have whatever other have. Like a child. Okay. Child and mother, they go to ice cream shop. And mother buy the ice cream. One for child, one for her. Okay. Now, see the child. He want to eat quickly so that he can have the ice cream from the mother also. This is called greed. So greed is what you have, but your eyes are on the other person also. What other have?
Now, for example, you go to the party. I don't know in Iran, but if you go to Indian party, there are greed people, who see very good food in a marriage party as if they have never eaten before in life, and you see how they eat. This is the greed plate. Okay, I show you. This is the plate of greed. Okay, and he is eating, but he's looking at the menu. What is left? And he want to finish his plate quickly so that he can have more in the plate, even if there is no space in the plate. Okay, this is called greed. So in greed, you suffer more. In the greed, you suffer more. But avarice is just to hoard it, just for the hoarding, like creating a bank balance. So what is avarice? So Raze, are you clear now? Avarice and greed with my example.
Yes, sir. Yes.
Okay, good. Now, avarice is an excessive desire to gain and hoard wealth. Only desire. He's not doing. He only want money should come, and he's happy to see his bank balance. This is like a genetic problem in India, especially in the ladies. It is very famous. That is why they don't allow the husband to go to buy something, because what is the problem of the husband? Whenever husband brings something from the market, the first question, in how many rupees you bought this? Oh, 50 rupees. In 50 rupees, only one banana? I could have bought 4 banana in 50 rupees. What a shame. So husband always has a fear to go for shopping if the wife is avarice, because she always has to, bargain. How many? I don't know how you bargain in Iran, but it is very common here, bargaining. Now, for example, if a patient comes to you and after you finish the consultation, or before you start the consultation, the patient say, I want to tell you one thing, doctor. Today I did not bring my purse, or today I did not bring my money, bring the money to pay you. Can I pay you on 7th day of the month? Why you want to pay? Why not today? See, on the 7th day of the month, I get my pay from the office. Okay, because if I have to pay you on the today, then I have to go to the bank and bring the money out from the bank. I don't want to bring the money from the bank. I want that the money which is in the bank should lie down, should be there in the bank. I don't want to bring it out. I never bring my money from the bank. I always wait for my salary to spend something. Even if, for example, it can happen that we don't have, for example, on the 1st day of the month, in my house, there is no butter. There is less vegetable. There is a less milk, or we are lacking something. I wait till the 7th of the month when my salary will come. Then I will buy more butter, more milk. Otherwise, I tell my family, 4 days, no butter. 4 days, no milk. You have to only see the photo of the butter. But I will not going to buy the butter. I will only buy the butter from my salary. Because whatever is in the bank, I don't want to bring it out. Maybe you hear, maybe you know somebody who behave like this, especially the salary class. Because the salary class, they don't want to bring money from the bank. They only wait for the salary to come to make expenses. So sometimes, what happened, how I understood this rubric. When I call few patients, say visit on the month this day, say on the 2nd day of the month, they tell me, doctor, can I come on the 8th day of the month, or 7th day of the month, or this day of the month? I don't understand why they want to. Maybe they are busy. Maybe they have no time. I used to think like that. So when these patients start to come, and I ask them, why you did not come on the 2nd day of the month, or that day of the month? Why you choose this day of the month? Because you are suffering. You should have come to me immediately because you have pain. Oh, because doctor, on the 8th of the month, I get salary. And I don't want to bring the money from the bank to pay you. So I thought, okay, I will go on the 8th day of the month when the salary will come. This is called avarice. This is not greed. Okay. But what is greed? What is greed is to look at others' plate. What you have is yours, but you want others also. So now what happened? Like a children. Okay. For example, now I give you an example. You have to tell me the medicine. When the mother say, I bring some chocolate at home or some sweets, my child, firstly, he will refuse. No, mom, I don't want to take it. Because he's afraid of new thing. But when I give him and he likes it, then he wants the whole chocolate for him. Then he will never share with anybody. Then he will take the chocolate and put in the fridge and says nobody will touch it. So there are two conditions. First, he will scare to taste it. Once he tastes it, he likes it. Once he likes it, then he wants everything, all the thing, ice cream, chocolate, food for himself only. Then he will not give to his brother. No. Then he will, it's for me. Who is this child?
Greedy.
Ayos?
Hyosamus. Very good. Hyosamus. Why Hyosamus?
Because he is fearful at first, and he
Yes.
tasted hesitatingly, and then he wants all because of it.
What is the rubric? The rubric is, Katie, you are very good, learning very fast. Greed, grasping greedily both hands, anything offered to him. This is a rubric, only Hyosamus. See, this is what you have to do. First, you go into the repertory, only read those rubric having one medicine. Greed, grasping greedily both hands, anything offered to him. First, he doesn't want, but when he likes it, then he want to have everything for himself. Now, when you listen this from the mother, see, mother says the typical problem of my child is, first, he doesn't take things when we offer him something new. But once he like it, then he doesn't want to give to anybody. Then he want to greed. Oh, this is for me. Everything for me. So greed is like this. So I hope you are clear with this. Are you greedy to learn more or not? Yes or no?
Yes.
Okay, greedy.
Yes.
Good. So now you understand what is greedy. So it means that whatever knowledge you have, you want to have it, but you also want my knowledge. Okay. So this is called excessive desire. Okay. Now what happens? It is the nature of the person to avoid spending the money and wish to have as much as possible for him to accumulate, is to become richer person, and there is no limit, and to store it in a secret place. To avarice may be due to fear for the future, for which he start saving. For saving, he stops spending the money and will not spend on the things which are very essential for his survival. Only. So what avarice person does, he will only spend the money on those products, those things which are useful for survival. No extra expenditure. He said, doctor, I know that, for example, 1 kg of apple is enough for us. So sometimes my wife says, bring more than 1 kg. I said, no, 1 kg is enough. So I have a budget. Out of the budget, I never spend. So for example, I know that. Now, what is the nature of avarice? A lady came to me. She has a complaint against her husband. She said, doctor, I don't like my husband. You know, he's so much saving the money from everywhere. You know, she said, the extent is, one day I was taking the shower and he saw that the light during the day, I was taking the shower and I switched on the light. When I came out of the bathroom, my husband asked me, why you make the light on? He said, because I was taking shower. I need the light. He said, why you need the light for taking the shower? You know where to apply the soap. So this is avarice. So, for example, avarice is a very, very typical condition. To buy calculated thing, very calculated. Not to spend more than that. And also, greed. How we see greed. Sometimes, Raja, please listen, okay? Another version of greed. Sometimes, the patient, they don't tell you that they are okay. They don't tell. When you ask the patient after the medicine, how are you? Oh, doctor, no relief. No relief. No, nothing else. Now, you have to play a trick here. The trick is that sometimes I tell the patient, if you don't tell me honestly, then perhaps you will get aggravation or perhaps the medicine will not work. Then the patient say, oh, okay. I tell you, I have 10% relief. But just now you told me there is no relief. Doctor, I told you no relief because I thought if I tell you there is no relief, you will change the medicine or you will reduce the medicine. So I did not want that you should reduce the medicine. I thought that, okay, if I tell you no relief, you will give me the same medicine, expensive medicine. So this is also a kind of greed to have more result from the remedy. You never can think that this is a greed, and this is hyoscyamus. So hyoscyamus patient will also not tell you in the beginning there is relief. He always feels scary that if I tell the doctor that I am better, perhaps the doctor will not give the medicine in the same way or change the medicine. Then the result will be different. So fear of being betrayed and greed. And sometimes the patient, they want more from the medicine. So they tell you very less. Oh, doctor, maybe 1% relief. Are you sure? Yeah, 1%. See, if you tell me lie, then the chances you will lose the 1%. Okay, 5%. See, if you tell me lie, you will lose the 5%. Okay, 10. So this is another kind of greed, to have more, not to tell the doctor that he is okay. Maybe you have heard such a patient, but maybe not, I don't know. But you have to be very careful with your patient. Okay, sometimes they lie you. Now, who is this patient? Who is this patient? This example? Anybody? We have rubric liar. And mostly it's like we have opium. And there's another rubric, liar, lies, never speak truth, does not know what she is saying, opium. Now, opium has a tendency to have more. So he lies. So opium are liar. And what is hyoscyamus? Naked. Hyoscyamus reveal the secret, but opium will not reveal the secret. Opium will lie. That is one of the tendency of the patients. Okay, so now I show you a case. So this chapter is closed. I told you different way of understanding, rubrics, Sehgal method. Now, what is greed? Selfish desire for more. What he has, he won't share, but like to have what other is having, or want to have everything of other also. Greed is like having a strong or great desire for food. Greed, cupidity. There is a word with greed that is called cupidity, means eager desire for wealth. So if we see the rubric, first we have to understand the rubric, we have to see the rubric in the repertory. You have to be very clear about the words given in the repertory with the rubric. Like for example, greed, only greed. Let's see. Cupidity. Greed, cupidity. So maybe you miss the word cupidity. Cupidity is to have excess of wealth. That is a greed.